All right. So, hello everyone, and thanks for joining us today. Before we begin today's conversation, we'd like to briefly introduce ourselves. I am Ashley Underwood. I'm a registered nurse educator and a healthcare leader with experience in nursing education, clinical practice, simulation, and healthcare leadership. Um, Throughout my career, I've committed to supporting nursing students, developing future nursing leaders, and advocating for excellence in patient care and professional practice. Joining me today is Dr. Sherry Raber, a nurse leader, educator, and advocate who's dedicated her career to advancing the nursing profession through leadership, mentorship, education, and service. Her extensive experience within professional nursing organizations and commitment to supporting nurses across all practice settings have made her a respected voice within the profession. So, as active members of the nursing community, we're honored to facilitate today's discussion and provide an opportunity for all of the ANA members to hear directly from one of the candidates running for ANA president in this 2026 election cycle. As we approach membership assembly later this month, members across the country are going to be considering who is going to lead our organization into the future and how we want that leader to direct the ANA in an increasingly complex healthcare environment. So today we're going to continue a conversation that was started in May of this year between Dr. Ray Coe when he sat down with Dr. Cassandra Cassidy to discuss his background, leadership experience, and his vision for nursing as we navigate this new era of nursing. So during that interview, he shared his perspective on issues such as nurse staffing, advocacy, workplace safety, and nursing education, as well as advanced practice and the importance of ensuring that nurses have a stronger voice in shaping healthcare. If you haven't had a chance to view that interview, we do encourage you to do so via Dr. Coe's website, which is linked on our Facebook page. It provides valuable insight to Dr. Coe's professional journey and the priorities that have shaped his campaign. So today's discussion is intended to build upon that conversation. So instead of us just revisiting topics that we've already explored, we're going to take a little bit of a deeper look into Dr. Coe's leadership philosophy, how he approaches governance and member engagement, and how he would lead the American Nurses Association during a time of significant opportunity and challenge for our profession. So joining us today is Dr. Ray Coe. He brings extensive experience in nursing leadership at both the state and national levels, serving as president of the Tennessee Nurses Association and also representing nursing through multiple ANA leadership roles, as well as dedicating his career to advancing the nursing profession through advocacy, leadership development, education, and organizational governance. So our goal today is to help ANA members better understand his vision for the future of nursing and leadership, and the leadership approach he would bring as the ANA president. Dr. Coe, thank you for joining us today and for continuing this important conversation as we prepare for the membership assembly. Let's dive right in. In your interview with Dr. Cassidy, you discussed many of the challenges facing nurses today. I'd like to start by learning more about the experiences that shaped your approach to leadership and prepared you for this moment. Throughout your nursing career, what experiences have most shaped your vision for the future of nursing, and how would those experiences influence your leadership as the ANA president?
Yeah, I think my leadership style has been shaped by leaders that taught me how to lead, as well as leaders who showed me how not to lead. I worked with several nurse leaders who were amazing, and I had a few that were frustrating. But the ones who were amazing led from within. They spent time with us, they talked with us, they listened to our concerns, they covered for us when we needed help on the floor or when I was working in other roles, they were there at the table with us, listening and saying, sometimes they were saying, what about? Sometimes they were saying, how can I help? But they were there with us. And that's what I hope to bring to the table, is to be present and to be able to remove some barriers that might pop up. I want to encourage people to accomplish their goals. I want to be able to help them reach their goals. I want to be able to help them clarify their goals and what do they want to do. And if there's something there that's preventing that, then I want to be able to help them overcome that obstacle. But I also want to be able to help them set a reasonable and realistic goal. We can't cure every problem that's facing nursing overnight. It's going to take, it took years for some of these problems to develop, and it's going to take years for some of these problems to be healed. But we can start a journey, just like our patients start a journey to healing. We can start the same journey as a profession. It's going to have some bumps in the road. There's going to be some times when we get frustrated and, pull a fit like some of our patients have done on us. But we need to stay focused on the outcomes that we're looking at, the goals and the objectives that are going to reach those outcomes, and our tactics that we are having to implement on a daily, monthly basis to reach those goals and objectives, to reach that final outcome that we're hoping for.
That's actually a perfect segue into our next question. You've spoken about healthcare being at a crossroads and the need for nursing to help lead the way forward. If elected ANA president, what would success look like at the end of your 2-year term?
Nursing has been and continues to be the backbone of the healthcare system. You don't have healthcare without nurses. But we have been, there have been times where they've just said, let nursing take care of it. Let the nurses do it. And we've got to stand up and say, yeah, we can do anything. As a nurse, we can pretty much do anything, but we can't do everything. We have to have time to think about what we're doing, to consider, like I said last time, we have to have time to consider the 5 rights. Are we doing right by our patients? Are we doing right by the system that we're working for? Whether you're talking about an individual patient or a healthcare system or the environment that we're working in, we have to have time to do an assessment, to create a plan, to implement that plan, to evaluate it, and make sure that we're heading in the right direction and that things are working the way we want. And right now, we've got so many tasks on our plate that you're just trying to get things done, and you don't even know if you're heading in the right direction because you can't look up and see what direction you're heading in because you're so focused on getting the next thing done. So we've got to figure out, how do we adjust this workload so that we're not so task-oriented, so intervention-oriented, but we're focused on providing high-quality care at the patient level, at the system level, to the healthcare environment itself. Are we taking care of ourselves? We've got nurses who are burning out because they're not taking care of themselves. Our workforce numbers are stagnant, if not declining in some places. How are we going to work and improve that? Because if you don't have nurses to deliver the care, who's going to be there to do it? I know some states are thinking about we'll just lower our education standards and that'll work. And I'm like, no, that's not going to work. That's not going to give you the high quality, safe, effective, efficient, timely outcomes that you're demanding. You're going to have to work with us so that we can do our job the way we know how to do it. But that doesn't mean like I said, we can do anything that falls within our realm. We've been trained to do everything within the realm of nursing, but we can't do everything all the time, all at once.
I think many bedside. Oh, sorry, I didn't mean to interrupt.
No, I'm just saying, you see kids play with Lego blocks. They do it one block at a time. That's how we do it.
Yeah, I think many nurses across the United States would agree with everything you said. thinking to that, what specific accomplishments would you hope nurses across the country could point out and say, ANA made a meaningful difference here?
I would hope that we get back to a sense of unity and purpose, that we link arms and move forward, and that we do it as a profession, that we quit eating our young, but that we build them up and we make them stronger. Not only because, you know, some of us might get hurt in a car wreck or something and need a nurse to take care of us, but eventually we're going to get older and we're going to need somebody to take care of us. So we're looking at our future caregivers. So we've got to stand united, and we need to stop letting people divide us with, salary increases for, oh, well, you've got, you're a BSN versus an ADN versus a diploma versus an LPN versus they're using anything and everything they can to divide us. And we need to start standing united and saying, you want us to do this? This is what it's going to take. We need time. We need adequate compensation. We need to be treated fairly and respectfully. We're not the trash that you're bringing in from the parking lot.
Yes, definitely. That voice of unity is something that we should see more of in nursing. Moving into thinking about consensus building and leadership, we're going to move to Sherry, who's going to ask our next question.
But Dr. Coe, leadership often requires bringing together individuals with different priorities, perspectives, and opinions. Can you tell us about a time when you had to build consensus among diverse stakeholders to resolve a challenging issue? And maybe talk about one challenging issue you were faced with and what you did.
I think the best way is kind of a reverse analogy, maybe. Let's talk about it this way. Have you ever pulled a string on a sweater and had the sweater start to unravel?
Definitely.
So think about doing it in reverse and finding the common thread that unites everybody and pulling it and have everybody grab on and come along with you. Like you were pulling, the boat's capsized and you've got the life preserver and you're pulling everybody out of the water and everybody's grabbed on and pulling forward. One of those times involved budgeting and letting everybody know what the budget was, where we stood, what we had, what we could spend, how we were going to spend it, and letting people know if I spend it on your priority, then I couldn't spend it on this person's priority. And everybody was in the room, everybody was at the table, and everybody was realizing and kind of had to sit, for lack of a better term, like a buffet and say, okay, I'm willing to give up this if I can have this. People had to think about what they were willing to give up to get what they needed. And we ended up focusing on what do you need? Not what you want, not what you'd like to have, but what do you need? And we ended up coming up with a solution that pretty much everybody gave me the 85% agreement on. Everybody wasn't happy with it, but everybody could live with it. And this was multi-specialties. I mean, nurses, physicians, PT, OT, radiology, pharmacy. Everybody's like, okay, we can make this work, because everybody knew what everybody else's priority was and what everybody else needed to survive. But we had open, honest, frank discussion. Some people got their feelings hurt, but everybody got a little something. Everybody gave a little something. Everybody got a little something. Everybody was happy. Nobody was ecstatic, but everybody was okay.
I think when I think about that answer, I think about the overriding thing that you're talking about is that clear, open communication. And taking that away from that experience, um, I'm sure it added to your bucket of skills as a leader. How would that, what you learned from that situation and how that open communication worked, how would that influence your work as the ANA president?
I'm a big believer in communication. I think you start off with clear definitions. This is what we're talking about. There doesn't need to be any miscommunication because somebody believes that the term means this and somebody else believes it means that. You need to start off with clear definitions of what you're talking about and work forward. Sometimes you have to start off with an outcome in mind and work your way back. How do we achieve this? What do we need to do? What are the goals we need to meet and make this work? What are the objectives we need to make those goals? What are the tactics we need to reach those objectives? Who's responsible for that? How can they work? And how do they need to work together? I mean, this is kind of like a construction site. How do we lay the bricks on the four walls so that the walls go up simultaneously? And make sure that people are doing their share in agreement and coordinated, but making sure that everybody understands their role, how it fits in with the overall plan, and how it fits in with us reaching our goal and our objective and our outcome.
Yeah, I think with ANA, you know, if you were to be elected the ANA president, just to kind of follow up with what you just said, there's a lot of committees, Dr. Coe. I mean, you have so many moving parts. So how would you really build those blocks that you're talking about and bring those pieces together with the moving parts and the different committees and the subcommittees within ANA itself that kind of reaches across the entire US. I mean, it's the picture is quite huge.
I'd love to say a simple Gantt chart, but that's not going to be the solution. But in a way, it's just, I mean, ANA also has a steering committee, a committee that looks at things like that and blocks people out and says, this is where you're at. This is where we're at. This is how it fits in. There is a steering committee. We have annual strategic planning reviews and about who's done what, where does it fit, what's the progress, who's having some difficulty, who's not, how can we help? Is there something we can do? And sometimes you got to wonder, is what we're talking about really something that belongs in ANA's lane? Do they have adequate resources? Should we bump them up a little bit? Are they over-resourced? Are they so far ahead because they're over-resourced? Do we need to pull something out and put it with somebody else? But you need to be looking at least annually, if not semi-annual, every 6 months, maybe looking and say, what's your progress? Where are you at? Where are you at on your timeline? Where are you at tactically, objectively, goal-wise towards the outcome? And if they're not in step, maybe look and say, is this what we need? If it is, then are we doing this right? Like in the nursing process, reevaluate. Have we implemented the right plan? Or do we need to change our implementation? Or go back to our assessment. Did we come up with the correct, for lack of a better term, nursing diagnosis? Or should we have looked at something else? Should we scrap this and try something else? I don't think there's anything wrong with saying, let's kind of look at this and say, okay, let's fix this and move forward this way. This way wasn't working. Let's look at another way. I think it's okay to say that.
I think that's a great way to put it. Always breaking things down. At heart, we're nurses. Everything for nurses goes back to the nursing process. And I think you have previously with Dr. Cassidy, and even today in this interview, you have talked about that boots on the ground, hands involved leadership, hands on, being willing to help. Do you think that having that leadership style will help you to have that more open communication across so many committees and the steering committee to be able to have a collaborative working relationship, to use the nursing process on the things that we're doing with the ANA?
I would hope so. I mean, it's a nursing organization. Surely we understand the nursing process. I know some people get tied to their baby, so to speak. And that's okay.
Agreed.
But maybe we need to look at another way to say, I know you want I mean, it's kind of like when I was teaching school before I became a nurse, I've had parents who really thought that their children were going to grow up to be pro sports athletes and making millions. And I'm like, yeah, they're not going to get off the bench. So let's look at other alternatives. I'm not saying throw the baby out with the bathwater. I'm just saying let's look at a different direction for this.
Agreed. And I think taking that honest look at things sometimes is what we need to do, because as nurses, we do get attached to ideas, and we have so many things that we're wanting to work on. Another thing that you have mentioned is going to segue into Sherry's next question. You talk about the aging workforce, and nurses leaving the profession, not necessarily, sometimes just because they burn out, but also we see an aging population of nurses that are from that boomer generation, and their experience very valued, but at the same time, they do have the right to retire and enjoy that. And so we'll segue into Sherry's next topic, which is membership engagement and how we grow ANA as an organization.
Perfect. So, Dr. Coe, with many competing demands on nurses' time, how would you propose ANA increase member engagement while also recruiting younger nurses, nursing students, and nurses from historically represented backgrounds into the organization? And I look at this myself as being, across all states. It's not just isolated to Tennessee. I think it really, I think it's very broad. And so I am interested in how you would propose, what you would do with those competing demands and how you can get more individuals engaged and grow our membership, not only at the national level, but maybe push down some resources and ideas at the state level, which many states need some recommendations on.
think I think the first thing we need to do is, if you're, work backwards, talk to the nurses. What do you want? What do you want from your nursing organization? I mean, some folks will tell you they want CEs. Some folks will tell you they want discounts. Some folks will tell you they want advocacy. What do they want? And then what can we offer? They might want something that we just can't offer. We've got to be realistic about what can ANA do. I wish we could do everything, but I don't think we can meet every nurse's desire, but I think we could meet the majority of the desires, the greatest desires. So if the greatest desires were for continuing education, I think we could meet that. If the greatest desire was for research to back up when they're having to deal with patients and say, hey, I know you don't want to do this, but let me show you why this is beneficial. If their desire is for, strength in numbers to bring advocacy, then I think we could work with, we have a large number of nurses. We have an even larger number of nurses with, we have a large membership, but we have an even larger number of nurses we could reach out to who maybe aren't members, but say, the ANA PAC has a button that says registered nurse, registered voter. The power of nurses as a profession is huge. and we can take that into the ballot box and say, this is what we bring to the candidates. I know that there are some professions, there are some lobbyists who bring bigger checks than what nurses do. But I don't think there's any profession, any lobbyist that brings a bigger voting block than what nurses do. So that's an advocacy tool that we should be able to harness and bring to our toolbox to say, our nurses need this. And if you bring this, we can bring this, get out the vote and get out this many votes for you. But also I think we need to work with our nurse partners, so to speak, our AACN, about what needs to be in a nursing curriculum from the point of view of working nurses. There was some stuff that was in my curriculum that I was like, I'm never going to use this. But how are we addressing AI? Because like it or not, we're going to be faced with it. But how are we working with, when we were talking about advocacy, how are we working with AARP? How are we working with some of these large member organizations who depend on nurses for their health care? How are we building them into our voting block and our advocacy block? How are we getting them to lobby for our needs? If AARP went in and was lobbying for safe staffing.
Agreed. I do think that building those relationships are good. I do also believe that our voices, nurses, needs to be heard, and we as an organization need to be sustainable. So on that note, we are ushering in, as an educator, I know this firsthand, we're ushering in a much younger generation of nurses. And sometimes it can be harder when we talk about that younger generation getting buy-in for a professional organization, much so more so than generations past. What do you think younger nurses are looking for in a professional organization that maybe generations previously were not looking for, and how do we reach that population?
I will be honest with you. I think our younger generation, just like every generation before, is looking for what's in it for me. But what they're looking for, that what's in it for me answer, has varied from generation to generation. My generation maybe was looking for a feeling of belonging to a larger group than just what was my work colleagues. So we need to figure out how does each generation define what's in it for me? I think the 20-year-old who's sophomore, junior in nursing school might define that differently than the 40-year-old who is a second career sophomore or junior in nursing school, who might define it differently than the 60-year-old who's saying, should I retire or not? The 60-year-old might be looking for something like, 4-hour shifts versus 8-hour shifts versus 12-hour shifts. Whereas the 20-year-old is saying, yeah, I could work 12-hour shifts if I could work 2 or 3 days a week and be full time. We're going to have to be creative. And I think some of our organizations want to look at one answer fits everybody, and it doesn't. It's kind of like an interstate highway. There's one highway, but there's 6 or 8 lanes, depending on, which highway you're at and where it's located. And you've got to be willing to have a presence in each lane.
I think that is a great answer and speaks to the need of flexibility and the art of nursing as a profession. How do we problem solve to reach all versus one? And continuing on in that vein, when we talk about different demographics, obviously ANA is not made of only one type of nurse. We have multiple areas where different types of nurses are needing different support. When we speak to advanced practice, maybe that's full practice authority in all states. When we think about nurse educators, do we have the resources we need to provide appropriate education? But I think one of the most important populations that we really need to speak to are our bedside nurses. They are the backbone of nursing. Throughout the campaign, you've spoken about nurses not being listened to and our voice not being heard, the increased workloads, and concerns regarding safe staffing. What specific actions do you feel ANA should take to improve conditions for bedside nurses and to strengthen our boots on the ground workforce?
So I think our advocacy work is going well. It just needs to be more, whether it be that we're looking for staffing in long-term care facilities, or whether we're looking at maintaining some of our staffing in our acute care facilities. We've lost pediatric beds. We've lost maternal child beds. We've lost psychiatric beds. But that doesn't mean we've lost the patients. And that doesn't mean the patients don't need nursing care. So I think we need to meet. Sometimes our advocacy, we focus so much on advocacy at the legislative level. Sometimes I think our advocacy needs to go back to the administrative level and say, maybe this isn't the pretty, and maybe this isn't the high income, but this is the service that we need to deliver, and find ways to bring that service back. We've let healthcare become so focused on intervention and so focused on profit that we forgot that healthcare started by caring, by providing caring, by being compassionate, and by spending time with people who needed us. And there's nobody more dependent on somebody who is caring, compassionate, and willing to work with them than those in a mental health crisis, or a child, or a woman in labor, or overall, just someone who's sick and can't care for themselves. I mean, I grew up I'm dating myself, but I grew up with Virginia Henderson's theory of caring for people till they could care for themselves, Orm's theory, some of these basic nursing theorists that said, this is what nurses do. We care for patients so they can care for themselves. And some of our most neglected populations are probably the ones that need it the most. They're the ones you see on the news, the folks who are acting out, are the folks who are left out. And we need to be, nursing is traditionally the one showing the care and compassion, but we can't do it for free. I mean, we have our own lives to take care of. We have our own bills to pay too. So our systems need to get pulled back a little bit from, if I'm not getting a great ROI on this service, this wing, then it needs to be repurposed and say, okay, does the community get a decent ROI on this? How does this fit into our community? And how do we maintain this service?
So looking at that, I feel like what you're saying is that maybe we should still focus advocacy at the legislative level, because obviously, ultimately, legislation is going to direct a lot of our practice.
Yeah, I mean,
but at the same
give it up.
time, shift some of our focus from only legislative and take almost a more grassroots approach with healthcare facilities, with maybe big hospital corporations, to make a better environment for our nurses so that we can get back to nursing care as it should be?
To get back to nursing care as we envision it. And that means we need our chain hospitals, our standalone hospitals to say, back to the table, what do you need? And we need the time and the place to take care of the people who need to be taken care of. The goodwill that generates.
Yes. So we've spoken about a lot of things. We did touch on education. We've touched a little bit on advanced practice. And you've spoken to that. I think you talk a lot about the voice of nursing. So I'm going to move on to questions about how we restore respect for nursing. Sherry, do you want to take that first question?
Sure, absolutely. When you talk about respect for nurses, what does meaningful respect actually look like to you?
Meaningful respect is not a pat on the back and good job. It's actually sitting down and listening to our concerns and making an attempt to understand our concerns and say, how can we help? It is working with us to improve on our work environment, to improve on our outcomes, and to make sure that nurses aren't walking away from the job because they get frustrated with being ignored.
I think that is very well put. So looking ahead to nursing in the future, as we look towards the future of nursing, but also healthcare as a whole, what do you believe is the single greatest challenge facing our profession that if meaningful change doesn't occur, maybe within the next 5 years, is going to have a significant impact on the way we provide care?
There's a couple of things. Funding, because if funding doesn't improve, I believe the system might, in certain areas, collapse. But the other one is staffing. If we don't have the people to do the work, the system will collapse. The system is not a standalone. You can't just throw money at it. If there's anything that travel nurses have taught us is you can't just throw money at it because some people have more money to throw. But that doesn't mean that you need to have underserved populations and well-served populations. And that brings us back to our discussion about what is good for the general public. I mean, we have deserts here in Tennessee where there is no maternal child care for miles. We have mental health deserts where there's no mental health care for miles. And that's not good for the general population when somebody goes into a mental health crisis and melts down in the middle of the street and starts acting out. That's not good for the general population when a mother has to deliver alone on the side of the road and then the baby grows up with certain needs throughout their lifetime.
And you know, we spend a lot of time within the media, within our professional organizations, looking at all the things that need to change. I think it's equally important that we take time to look at what we have that's going well. So on the opposite side of that, what gives you the greatest hope for nursing in the future?
The motivation of the students who are in nursing programs. They're there because they want to be there. They want to be nurses. They haven't burned out yet. We haven't knocked it out of them yet. They're there because they want to be there. And if we can keep stoking the fires of that motivation till they get into the workforce and keep it with them, keep it energized, keep fanning those flames while they're in their first 2-3 years of working. I think we'll have several well-balanced, well-educated, motivated nurses who really do a good job.
I would agree. I think that we're fixing to see a whole new generation of nurses that have so much potential. Um, as we conclude today, I do want to give you an opportunity to speak directly to the nurses in the profession. So, if you could deliver one message to every nursing student, every new graduate bedside nurse, advanced practice educator, administrator, all the nurse leaders across the country, what is what statement would you want them to hear from their next ANA president?
I mean, assuming I get elected president, my goal would be, I understand you're frustrated. What can we do? How can we work with you to deal with that frustration? I can't fix it on my own. The organization can't fix it on its own, but we would have to work together with you as a member, working with your district, working with your state, and working with us at the federal level to identify and implement potential solutions. But just as with patient care, it's not going to be fixed in a day, a week, or a month. It might take us a while to do that. So bear with us, work with us, and support us.
Very well said. Well, thank you for sharing your time, your experience, and your vision for the future of nursing. I think we can definitely see the passion that you have for our profession. As ANA members are preparing for that upcoming membership assembly and our presidential elections, along with all of our other elections, I think that conversations like this help all of us to really gain a better understanding of our priorities, values, and leadership perspectives of those that are seeking to serve our profession at the highest level. And I think that it's very important for us to have these open conversations because communication is so important. The future of nursing is going to be shaped not just by the challenges that we're facing, but by the leaders that are willing to listen and advocate and work alongside nurses across all roles and all practice settings. So we'd like to say thank you to everybody for joining us today and for your commitment to nursing and the future of our profession. We encourage all eligible members to remain engaged, learn about the candidates, participate in membership assembly activities, and ultimately, no matter what, make your voice heard as we move to shape the future of the American Nurses Association. If there's one thing you can take away, it's making yourself heard. So thank you for joining us, and we look forward to seeing many of you at the membership assembly later this month.
Thank you.
No, thank you.